Assalamualaikum warahmatullahi wabarakatuh. Hello, good afternoon, Indonesian teenagers out there. As we know, the COVID-19 pandemic continues to spread out of the entire world. This pandemic has also forced people to stay at home. It was done to prevent the spread of the coronavirus. Hence, most countries urge their citizens to stay at their home when there is no important reason to go outside. The changing patterns of people's activities left business world days late. In keeping the economy in balance, staying at home is judged to be permanently inapplicable. Recently, the government has allowed those under 45 years old to do normal outdoor activities. The school is also projected to reopen in July 2020. On the other hand, viruses are still widespread in communities. The infection occurs easily and quickly, but the vaccines have not been invented yet, so that the new normal will be implemented. What is the new normal exactly? New normal is a change in behavior to keep running normal activities. This change is added with implementing health protocols such as reducing physical contact with others, limiting the number of crowds, having to wear masks everywhere, screening temperatures in every office or mall or even schools, diligently washing hands, and limiting official or personal travel and are only allowed when circumstances are really important.
Lately, various terms have emerged such as herd immunity and new normal that have been widely discussed by the public since the coronavirus pandemic. However, most people still don't understand the two terms. Herd immunity and new normal are not the same. Both have specific differences, including: first, herd immunity is a condition when some groups or human population are immune to a disease because it has been exposed and recovered from the disease, whereas new normal is a change in people's behavior to continue to carry out normal activities. Second, someone who has herd immunity has been infected with the virus, while someone new normal is not necessarily infected with the virus.
Third, herd immunity only occurs when more than 70 to 80% of Indonesian population is infected with a virus and has more immunity, while new normal will change life behavior so that it is not infected with the virus, such as always wearing a mask and washing hands. Fourth, a person who applies herd immunity is already immune to disease, whereas new normal people must implement health protocols to prevent the spread of the virus.
When a country will implement a new normal life, the country must meet conditions given by World Health Organization. Following are conditions stated by Dr. Hans-Henry Piglich as a World Health Organization's. First, proof that the transmission COVID-19 has been controlled. The second is public health and health system capacity is able to identify, isolate, test, track contacts, and quarantine. The third is reducing the risk of outbreaks with strict arrangements for places with high vulnerability. especially in older people's homes, mental health facilities, and overcrowded settlement. The next, number 4, is workplace prevention is established, such as physical distance, hand washing facilities, and respiratory application etiquette. Number 5 is the risk of spreading imported cases can be controlled. And the last is the community plays a role and is involved in the transition. In addition to meeting the requirements, Indonesian Minister of Health also made guidelines on how the new normal life continuity in the workplace must be obeyed by the community. The guidelines include 1. Must provide hand washing facilities. Number 2 is periodic disinfection every 4 hours. Number 3 is all of community must use a mask. Next, all of workers must behave clean and healthy. Next, all workers and visitors are checked for temperature. Workers or visitors have a body temperature above 37 degrees Celsius after double checking, it is not allowed to enter. The workplace also must post information about limiting physical distance, washing hands, and wearing masks. For physical distance, workers must be given a special mark to limit the distance, set the number of workers entering, and the workers' desk must be at least 1 meter apart. To minimize contact with consumers, it is suggested to use a barrier as additional protection and use a non-cash payment method. And the last, to prevent crowd, limiting the number of workers or customers entering, implementing a queuing system at the entrance with a minimum distance of 1 meter, implementing service hours, and reducing direct meeting with consumers.
The Coordinating Ministry for Economic Affairs has compiled the stakes or phases of opening business and industrial activities after the spread of the Covid-19 pandemic, which aims to restore the Indonesian economy back to the normal. The timeline of the new normal phase is divided into 5 stages that are: the first phase, June 1. Industry and service can operate with the COVID-19 health protocol. Malls can operate except make-shop and health facilities. The second phase, June 8. Shops, market, and malls are allowed to open, but with health protocol. The third phase, June 15. The malls remains like phase 2. But there are evaluation of opening salons, spa, and others, but still with the COVID-19 health protocol. And the school was open but with a shift system. And the next is fourth phase, July 6. Opening of economic activities with additional evaluation for the gradual opening of restaurant, cafe, bar, and others with strict hygiene protocols. Workshop activities are allowed with a limited number of workshoppers. And the last is fifth phase, July 20 to 27. Evaluation for fourth phase and opening of place or economic activities and large-scale social activities. In addition, in the end of July or early August 2020, is expected that all economic activities have been opened.
New normal is a change in behavior to keep running normal activities. This change is added with implementing health protocols such as reducing physical contact with others, limiting the number of crowds, having to wear masks everywhere, screening temperature in every office or mall or even school, diligently washing hands and limiting official or personal travel and are only allowed when circumstances really important. Indonesia must be really ready to implement this new normal because when Indonesia is not ready, we'll make a big loss. This change certainly has advantage and disadvantage. The benefit from implementation of new normal in Indonesia is to redress economic activities whose growth rate had dropped in the first quarter of 2020, which was only 2.97% according to the Central Statistics Agency. In the period of lockdown or quarantine at home, it has a negative impact on the economy. For example, business operators stop their operation completely, and the number of layoffs also increases. To restore the economy so that it can run normally, the Coordinating Ministry for Economic Affairs has compiled the stage or phases of opening up business and industry. The phase is divided into 5. With the holding of new normal, it will drive economic activity so that it will increase the rate of economic growth that had slumped. Losses due to the application of the new normal in Indonesia that will trigger a second wave of Covid-19 or make positive cases of coronavirus jump. This is because if Indonesia implements new normal, it means that people carry out activities as usual. For example, work or school. Work will meet with many people and we do not know whether the person is carrying the coronavirus or not. Then we accidentally contact physically with them and most likely we will be infected. Likewise, when we go to school, especially children who do not understand about this virus will be vulnerable to contracting the coronavirus. New normal will increase the chance of the virus spreading more quickly.